Happy 2021. This is Damian David with Healthcare Triangle. Welcome back to Week in Review. It's week number 32. I missed last week. Sorry about that. Had the holidays going on. A couple things changing here and there. Hope everybody's safe, healthy, and well. Let's get back into it. We're going to do some headlines. We're going to do a nice interview video call follow-up to Melissa Hall conversation. She was participating in the Moderna clinical trials. So she's got a little message for us she wants to share, and also a little bit of follow-up to how that testing in the trial is going. And then I'll leave you with some visions of a hopeful new 2021 in the world of COVID-19. So here we go, headlines. New COVID variant. In the UK, they discovered a new variant, B.1.1.7. Okay, so that's the new variant for the new year, if you will. The new Cova variant is being detected throughout the world, and the data might be warning us to prepare for another surge related to that new variant. So be on the lookout, be diligent, continue to wear the mask, please. Let's continue to be there for each other and be safe. Let's get to the vaccines. So now up to date, as of yesterday, it would be January 5th, the U.S. has administered over 4.5 million vaccine doses, but it's behind compared to the other countries as we look to catch up. So hopefully in the next couple weeks to the next couple months, a lot of us, especially in the healthcare world, will have access to the vaccine, though I am hearing that it might take a couple of years to actually infiltrate all throughout the whole population of the world. So I don't know. Hopefully we'll get there sooner than later. Spread warning. An asymptomatic California hospital care provider wore an air-powered holiday costume. It was like a puffy blow-up tree, if you will, throughout the ER to spread holiday cheer to the patients and coworkers. Since then, herself and 43 other persons that were in close contact to her have tested positive with COVID-19. I say that because the investigation is still enduring. It's not determined whether or not that air suit was the reason for the spread. But it was the battery-powered air pump that inflated the costume that is the major suspect agent in this case. And the costume utilizes that air pump to stay inflated and puffy. And the experts are thinking that the air pump system might have spewed viral droplets further than the normal person-to-person spread. I'm going to keep track of that one. And if I hear contrary to that, like, no, it wasn't the suit at all, I will update you. I don't want to be an alarmist. However, I do want to include this to make sure that we're all careful in some of the decision making that we do. Even the best intentions can lead to some pretty poor results, if you will. So, okay. In Singapore, they've been beginning to use data that's been obtained through the COVID-19 contact tracing technology for criminal investigations. So that's very interesting. I'm going to follow up with that too. I don't know if it's COVID-19 related criminal investigations that they're using it for, or if it's just criminal investigations that they happen to gather data while they were doing the contact tracing. I'm going to keep an eye on that to see if it trickles into other countries like the U.S. And also to follow up. I know Singapore has been pretty conservative in their approach to criminal investigations in the past, so maybe that's just because they're so tight on that. In LA, a COVID surge is causing backups in the ambulance transport and hospital intake capabilities. Ambulance services have been given the directive not to transport patients to hospitals that have little chance of survival. So Dr. Jeffrey Smith, COO, as an example of what would qualify for not transporting would be, quote unquote, patients who have suffered from cardiac arrest and are unable to be revived in the field. That's just an example, but in essence, they're saying let's not go through the motions and bring them into the hospital if there's no chance to help them in their survival. So quite alarming there. That just means that they're being bombarded with another surge. I hear over thousands of cases a day are happening in the LA area alone. So let's get to the stats. Week number 32. Again, this is the week of January 6th, 2021. Pleasure to say 2021 versus 2020. Let's get to the stats. So around the world, we have 74.4 million confirmed cases this week, up from 64.5 million cases from 2 weeks ago. So I missed a week there. Of that, 42.1 million have recovered, up from 41.5 million 2 weeks ago. And then we're up to 1.65 million deaths around the world, up from 1.49 million deaths 2 weeks ago. constraining that, narrowing that down into just the U.S., we're up to 17 million confirmed cases in the U.S. Over 2 weeks, that's up from 14 million cases. So 3 million cases in the U.S. just in the past 2 weeks. We're up to 308,000 deaths in the U.S., up from 274,000 deaths 2 weeks ago. So that's our stats. Vaccines are coming out. I mentioned that. So Melissa Hall, she reached out to me. She wanted to follow up. We had checked in with her about a month ago. She's a participant in the clinical trials for the Moderna through the University of Maryland. Real excited to hear about that in the news and keep up with that. I wanted to follow up with her anyway, so I thought it was a good time. She has a message, though, that she wanted to get out there. She wants people to feel comfortable and confident in taking that vaccine. She thinks it's the right thing to do in this time to help eradicate and get past COVID-19, and she doesn't want people to worry or fret about it in the decision making. She feels it to be safe. Let's jump now to that conversation. She can spread some light onto what she means about that. And then after that, I'll bring you back with some images for a more positive 2021. Happy New Year. Hope you had a great holidays. Glad you're still around and listening to Week in Review. Stay healthy, stay safe. Let's jump to the conversation with Melissa Hall. Thanks. Hey, Melissa, how you doing? Good to see you again. Thanks for coming back.
Hi, Damien. Thanks for having me. It's good to see you.
Yeah, good to see you too. I'm glad you're looking pretty healthy and looking like you're doing well with everything going on in your neck of the woods, as well as the participation in the vaccine trial there. So yeah, I'm glad to see that.
Yeah, thanks.
So speaking of that, it's been a couple weeks since the last time we talked, and I wanted to catch up with you on how everything was going for you in that vaccine testing. It's pretty exciting times. I know UK started distributing vaccines to folks like just about over a week now, and then US is close behind. We started delivering them to the first wave of healthcare workers. You were just mentioning that you guys got passed over, but you might be on the second round here. And then it's exciting because I know you're involved with the clinical testing for the Moderna vaccine. That, my understanding is, that might be happening. That might be starting to be distributed within a matter of days. So that's pretty exciting. I want to hear from you what your thoughts are around it. I hear rumbles for everything from people worrying about whether or not the vaccine is safe, whether it's effective. What are your thoughts on that?
So thanks. Yeah, when I first decided to do this vaccine, I did it because, I wanted to be able, as a nurse practitioner, to tell my patients that, when the vaccine is available, that, whether I got it or not, I believe in the process and I believe in what vaccines can do. And having seen the fallout from this virus, it makes it even more pertinent that I was involved in this study. And I actually got an email from Moderna yesterday telling all the study subjects that, they're meeting with the FDA today in order to see if they get approval for the emergency use authorization. And then we have the option as study subjects to stay the path. We stay blinded, we don't know anything, and we just stay in the study that way. Or we can be unblinded, find out if we got it, and if we didn't get it, they're going to give it to us. So, to me, that means that Moderna is standing behind their product, and they're the safety and well-being of the people in the study is just as important as the people outside the study, the regular lay person, as well as healthcare workers and first responders. But I found it very reassuring to have them say that, because a few weeks ago it was just stay the course and we'll tell you, what your options will be. And so I feel like, yes, I don't know what I got. Correct. I don't. But I do know that of the people that are in the group with me that I see when I go in for blood work and all that. Can you hear me? Because I see that I'm frozen.
Yeah, you're frozen, but I hear you fine.
I feel like I'm able to speak to the fact that this is important. no, I can't say for sure that the vaccine is completely safe, but there are so many people, even within my department, that are questioning whether or not they should get the vaccine, that I feel it's important. They know I'm in the study, and it's that important to think about the safety and well-being of not only yourself but those around you. So, it's kind of, I've changed my whole approach and my message when I talk about being in the study now. I don't try to tell people, yes, it's safe. Well, I can't say that because I really don't know what I got yet. But I'm going to find out what I got. And if I didn't get it, I'm going to get it. End of story. I believe in this process, and I believe that, 94% efficacy, and also decreasing the symptoms, the severeness of it if you get it, is important. And so for that reason, I've made that decision to go down that path, if that makes sense.
Yeah, sure. It makes sense. You answered my follow-up question, which would be if you found out that you had not had the vaccine, would you at that point take it if that was your option from Moderna? Sounds like you would. And I think the message that you're pushing is that, hey, it's worth getting. It's safe. You have the understanding that it is a good solution potentially for this COVID-19, and I think that's in line with what I reported on last week, which was we heard from former presidents Bush, Clinton, and Obama, who all stated that they were going to take the vaccine as soon as available to them as well, to be stewards to the public and the community, and showing them that it was the safe thing to do and the right thing to do for this pandemic. So I don't know. I give you a little bit of kudos for partaking in the trial, and even bigger kudos for going on about this and spreading the message that, hey, let's get into this vaccine when it's available and see if we can eradicate this pandemic. So I appreciate your efforts, and I appreciate you putting yourself in the line of fire for the safety and the future health of our communities.
Well, thanks. Like I said, and even here, our COO has said that he's willing to do it, to get the vaccine on video to help, reassure our staff that, this is a good decision. It can only help you in the end. Don't let your fear of the unknown, ruin your chance to be safe and make your family safe. So it'll definitely be interesting, but I'm very interested to see what I got, because they're also going to let us stay in the study even if they unblind us. So I'm going to stay in the study no matter what, and so it'll be interesting to see how it changes going forward once they've unblinded a lot of people, because I'm expecting there will be, because there are a lot of healthcare people in my group, a lot. It's at the University of Maryland Medical School, so they sent it out to all of their residents and their providers and their nursing and everyone in the healthcare arena. So I'm expecting there will be a lot of us that are unblinded, at least for the state of Maryland. So we'll see what happens.
I got a smile on my face because that only foreshadows one thing for me, and that's follow-up phone video call with you number 3. So
Hey, well,
I definitely want to continue and hear throughout the conclusion of this trial. So it's interesting to me, and I can only imagine what it was like back in the days where they were testing and they were starting to administer the polio vaccines and the vaccines that have come before this. So
right.
yeah, great message. I really appreciate it again. Glad to see that you're still healthy and that everything's going well. Hope you the best of the holidays. But before I let you go, Melissa, the hot seat question. You ready for it? Got to get everybody in on this. All right. So my new question for you, seeing you've already had one of these, is when all is said and done, when we're clear and things start to open up back up again from COVID-19, what's the first thing that you'll do for fun? And can you guess what you'll enjoy most about it? As an example, let me let you know. So people have started to kind of talk to me on the side and be like, you always ask these questions, but then you never put yourself myself on the spot. So just to go first on this new question, the example for me is I'm going to rebook the trip to Reykjavik that I'm supposed to go on next week, just because at this point, as a U.S. citizen, I can't even get into Iceland. So I'm going to go ahead and cancel that and rebook it. And I think the thing that I'll enjoy the most is being able to check off something that I've wanted to do, jump in a frozen lake during the winter for years. So there's mine. What do you have for me?
Yeah, I'm not doing that. That's too darn cold. But I still think that'd be a fun place to go, just not in the cold. So immediately, I probably will want to go, and this is terrible, but I'll probably want to go shopping. We talked a little bit in the past about, I miss Black Friday and all that, and I miss that whole environment of shopping, because that's a good outlet for me. So I'll probably do that, even though I expect it will look a little different, because we'll still have to be masked, and what is the environment going to look like and all that. And I've tried to stay away from that right now, even though that's the thing I want to do, and I'm tired of going out to the dog park with my dogs. So but then the other thing that my husband and I just brought up yesterday was, we were supposed to go on a group Hawaii trip for 2 weeks in September of this year, and we did not go because of the pandemic. And so now we're trying to talk about, what are we going to do next year? We should plan something, because I think it's our 20th wedding anniversary, even though we've been together longer, and it's my husband's 50th birthday. Wow. I'm not going to say how old I am, but so we've decided that we need to do something big. We had already talked about it, but the question is, when do we do it? And, where can we go that they're going to let Americans in, and all that. So, and the funny thing is, we got our credit for our cruise, and it said we only had a year to use it. And we actually got an email from the cruise saying that they've extended it another year. And my husband's response was, well, isn't that kind of funny? So he thinks Alexa was listening and notified Royal Caribbean and told them that we were thinking about doing another trip. And all of a sudden that email came. So, but like you, I need to plan a vacation, because it's going to be difficult, I think, to go away, because everybody is going to want to go away. So, it's going to make it a very interesting endeavor. So, but we'll see what happens. But yeah, I need a vacation.
I didn't even think of that.
Yeah.
Well, hey, again, happy holidays. I know we're about a week away, really, from Christmas season. So that's coming up real quick. So happy holiday, Merry Christmas if you celebrate it, and I look forward to catching up with you again in the new year. And hopefully it sounds like 2021 is a big year for you and your husband, so I hope it goes smoother than 2020 has for everybody. And look forward to touching base with you after the holidays.
Great. Look forward to it. You have a good holiday yourself. Thank you.
Thanks, Melissa. Take care.
Okay.
Again, thanks to Melissa Hall, and thanks for you again for tuning into Week in Review. I apologize for this hair, this facial hair. It's been a week. I decided not to do anything over the New Year's. My New Year's resolution is to be a little bit more present. In doing so, I haven't had time to shave yet. By the next time, this will be gone. Hopefully, this will be trimmed up a little bit, and we won't have the corona hair that I had all of last year in 2020. So, again, Happy New Year. Here's some great visions for a positive 2021. Let's get back into it, but let's not get too far in there. Let's still be safe. Let's still be diligent. Let's still be there for each other. Take care. See you next week. Thank you.